Hello, welcome to Mama Juice.
Hi, thank you so much for having me.
Of course. And do you want to introduce yourself and let us know who you are and what we're here to talk about?
Yeah, for sure. So my name is Juliet Miller. A little bit of background on me. My first education was in women's studies. I have a BA in women's studies from UC Santa Barbara. And then I went to nursing school at Arizona State, got my BSN there. And so now I work at the University of Utah as an inpatient OBGYN nurse. So I do postpartum, well baby, low-level NICU, high-risk inpatient antepartum, and gynecology. So I kind of do everything in obstetrics, except I don't actually do labor and delivery, but I do like everything before and everything after. So I do that full time, and then I'm also in school at the University of Utah. I'm getting my Doctor of Nursing Practice. I have a dual specialty. It's a dual program. So when I'm done, I'll be licensed to be a certified nurse midwife and a women's health nurse practitioner. So yeah, that's.
Well, I just feel very unaccomplished.
Well, let me tell you, if you had asked me to list my failures, that would be a much longer conversation. I had like six. I mean, I got my first degree and then kind of wandered around the wilderness for like 6 years before going to nursing school. So, I mean, who doesn't do that in their mid-20s? But it definitely it took me a minute, and I'm actually not a very good student. So the fact that I'm where I am now, I just like. I'm just like crossing my fingers that nobody finds me out, but
right. Well, I'm the same. I'm a doer, not a learner. That's what I say.
Yeah.
Like if you get with me and teach me something, I can do it. But if I sit and stare at a board and watch someone talk, I just zone out and I'm like, where am I?
I know. Well, with Zoom school now, it's like even when I went to lectures on campus, like it was so difficult for me to pay attention for like an hour and just like sit there and listen. And now it's even more challenging on Zoom. I'm like, it's really difficult, but luckily things are recorded so I can, make it work that way. So online learning is actually like working pretty well for me, but yeah, definitely not my strength. I know. I hope I'm a better nurse than I'm a student.
I'm sure you are. Could you imagine being like the kindergartners or first graders that are trying to navigate this?
I cannot, because I cannot navigate it as a 33-year-old. Like,
right.
Or like, I mean, I can, but it's because I know that I can like do whatever I want on my computer while I'm on a Zoom meeting, right? Like if that wasn't something that was given to me and I really had to sit there and listen, I don't know how I would handle it. I can't imagine being them.
No, I feel so bad for them. Luckily, my daughter has a fall birthday, so she's not starting kindergarten until this coming fall, and we'll see what it looks like then.
Yeah, for sure.
But wow, that's so exciting that you do all the things.
Just a few.
All right, so we wanted to talk a little bit about myths surrounding midwives. I actually, when I had my first daughter, I was at a women's expo and I watched some documentary and I don't remember now what it was called.
Was it The Business of Being Born with Ricky Lake?
Yes. And I was like, I need to have a midwife and I need to be all natural and crunchy. And so I was on state insurance though at the time. I was on Medicaid. And so I'm like, well, there goes that. Like I can't afford a midwife. So I'm at this women's expo and I see this big booth and it's midwives. And I was like, well, I'm sure I can't have one of them be my midwife, but maybe I'll go ask them questions. And so I started talking to one of them and I mentioned like, oh, I have state insurance. I have to birth at a hospital, so I can't have a midwife. And she goes, what plan do you have? And I tell her, she's like, we can see you. And I'm like, what? So they actually worked out of an OB/GYN clinic. And so I'd never heard of that. I thought like midwives were completely separate from healthcare, right? So I start seeing this team of midwives at this OB/GYN clinic, and then I ended up getting to have a midwife deliver my daughter in a hospital setting, which for me, like I appreciate natural and how moms wouldn't do home births, but my anxiety wouldn't let me do it because I'm like, if there's an emergency and I don't get to the hospital in time, and I did end up hemorrhaging, so it's kind of good that I was there. But it was a great experience. Like my mom was like, she did such a good job. My daughter was 9 pounds, 4 ounces, 22 inches long, not a single tear because she helped the process, you know? So I definitely have a very positive experience with midwives, but I'm curious to hear what myths that you have heard around the practice of midwives.
Yeah, I think that you just hit on a really important one that actually is a barrier for a lot of women to getting midwifery care, which is the idea that either to have a midwife birth, you can't deliver in the hospital, or that you can't have an epidural, or that unsafe. I've heard people say like,
Right.
oh, I want to have a doctor just in case something happens. Truly, in most hospitals, if you're in a hospital, no matter what happens, if there is any kind of an emergency, care probably won't be delayed to you if you have a midwife or a physician, because the nurses are the same, the protocols are the same. Like there is like a backup, obstetrician who would act like who's a surgeon if you need a C-section. There's anesthesiologists. And so as long as you're delivering in the hospital setting, they're really, I don't know of any associated risks that come with it. I only know of associated benefits.
Right.
I also, I know that there are some people whose insurance won't cover it. Those tend to be kind of smaller, more kind of weird insurance companies, but they won't cover midwifery care even in the hospital setting. And I'm not sure why. I don't know if it's because there's this idea that to have a midwife is some kind of like boutique birth. When midwives have attended births for almost all of human history and still today attend the majority of births that are happening right now. We kind of are in a unique time and place where midwifery is the exception instead of the rule. So yeah, I think that that is a big one. I will say, just to kind of start off, there are different kinds of midwives. And one thing that makes talking about midwifery kind of tricky is the fact that every state in the United States has different laws regarding midwifery and different kinds of licensure. So there's something called a certified nurse midwife, who are the only midwives that are able to deliver in the hospital, who are nurses first, and then go on to get either a master's or a doctorate in midwifery out of a college of nursing typically, which is what I'm doing right now. And those midwives, like I said, are able to attend hospital births, and they also see patients in clinic, gynecologic care throughout the lifespan, and also are licensed to give primary care. So like if you have a sore throat, you can go to your midwife and she can do a culture and she can order you antibiotics. And then if it's like something is really weird, she can refer you to a specialist. So nurse midwives basically can perform all the functions of a GP. And for that reason, I think a lot of women of childbearing age do well to just kind of have a midwife as their primary provider, assuming they're in pretty good health and their main health needs kind of revolve around birth control, family planning, pregnancy, all that stuff. So yeah, that's something that's kind of that a lot of people don't know. So, and like I mentioned, I'm in a dual women's health nurse practitioner and then certified nurse midwife program. So something that's kind of interesting is that being a nurse practitioner grants me no additional privileges or scope to being a nurse midwife. So a nurse midwife can do everything a nurse practitioner can do with the addition of attending births. Yeah.
So then what is the advantage for you doing that dual program?
What's the point? That is a really good question. We ask ourselves that. So it's one additional semester and you get a whole nother license, which is kind of cool. You do get a little bit more training in complicated gynecology. And so if your interests go less towards the obstetrics and more towards hormone therapy or pelvic pain or anything like that, then you get an opportunity to be a little bit more immersed in that in your training. And, unfortunately, I think that one of the other benefits is that most people know what a nurse practitioner is, right? Like they know that you go to a nurse practitioner when you have a health issue, they can diagnose you, they can give you medicine, they can refer you. Most people do not have a very good idea of what a nurse midwife is.
Right.
So for me, part of it is just like feeling like it helps other people understand like
Sure.
my scope better. But I might actually drop out while we're talking about it, because I know some people who have completed the program and dropped out of the nurse practitioner part of it and are really glad they did. And I know people who went with both and graduated with both and are actually letting their nurse practitioner license lapse because it didn't serve them at all. And it's just like another thing to keep up and pay for every year.
Yeah, exactly. Yeah. Because a lot of people don't know that those licenses also come with, like you said, upkeep. You have to pay, you have to attend conferences and stuff, if I'm correct.
Yeah. Continuing education and.
Right. Yeah. And so I think we've actually come a long way, even with, I mean, I've been in healthcare for 12 years now. And I remember probably over the last 2 or 3 years, I feel like people have a better understanding of what like a nurse practitioner and a PA, even a physician's assistant, do. Whereas I remember a few years ago, especially the older population, they're like, I don't want to see a nurse. I need a real doctor. I'm like, what? I prefer, like, my primary care is a PA, and I prefer her to the MD because she's more thorough. She's more inclined to say, let's find out what's going on and say, let me write you a script for this pill that I have for that. So I just think that's interesting too. So I wonder if that shift will come for midwives as well once, people like you speak out and we get more education on it.
Yeah, I hope so. And one thing I realized I forgot, well, I kind of started and then I stopped, but so we have the nurse midwives, which is what I am, who people will argue are the highest trained.
Sure.
Which they are the highest trained in like certain parts of it, right? And then there are what are called either certified professional midwives or licensed professional midwives, who are midwives that are not nurses, aren't like trained in the academy, like nurse midwives are, but have a license from the state. They get a lot of their training through apprenticeships. And then they have, to be honest with you, I'm not like super clear on it, but there are governing bodies that they get licensed through. Okay. And then those midwives do home births and birth center births, and don't practice in the hospital, and then are not able to prescribe meds. Okay. Or give care outside of the pregnancy or the birth. But they don't have like the full diagnostic and prescriptive authority of a nurse midwife. And then nurse midwives, primarily, it's like 95% of nurse midwife births actually happen in the hospital. But depending on the state, they can also attend births in birth centers and the home. Here in Utah, nurse midwives can attend births in the home, but I think there's only like 1 or 2 in the whole state that do it.
Wow, interesting.
Yeah, I think that part of the reason why we have these myths or these misconceptions is because, frankly, it's complicated,
It is.
And like if someone just hears that, oh, their neighbor had a midwife and they, had a home birth and had birth in, their bathtub or, whatever quote unquote crunchy things we think of, then yeah, that's exactly what happened with a midwife who is practicing midwifery under the law. And it's also really different than the other midwife births that happen. So I feel like it's a really unfair. Other countries just have like, you go to school, you become a midwife, and then you're a midwife. Just right. Like you go to school, you become a dentist, and then there's a dentist. There's not like this kind of dentist and this kind of dentist, And so I really feel like we do a disservice by having that confusion. Unfortunately, there is a stigma in the field of obstetrics surrounding women who choose to birth with somebody besides an OB or a nurse midwife and have another kind of midwife either at home or in a birth center. And I think that it actually leads to, just those situations not being well integrated, right?
Right.
Where like, let's say there is some kind of a complication or an issue, like they're not able to consult with a physician like nurse midwives are. And they're like the transfer of care isn't as seamless. So I wish that it was all just a little bit more inclusive. so that people can kind of have the best of both worlds, or best of all the worlds, or a lot of worlds when it comes
Right.
to.
Well, I feel like that's kind of like until this moment, until speaking with you, I did not realize that I must have been seeing nurse midwives versus a certified midwife.
Mm-hmm.
So even though I went through the process, I still wasn't that educated on it. And so hopefully that's something that can become more normal, like you said, in other countries, and in other countries where they have more successful full-term healthy births where mom doesn't die. They do utilize midwives. Like, I mean, that's a thing. You get pregnant, you have a baby, you have a midwife, you know. And another thing I wanted to ask you about, I know the difference between a midwife and a doula, but I think a lot of people interchange them just because they're not educated on it. So do you want to speak on that a little bit?
Yeah, I'd love to. I actually was just asked this. Well, I've been asked this a few times. It's kind of funny. I'll be really frank about this. When I get asked that, I get a little bit defensive because I'm like, what's the difference? Like, about 8 years of school is the difference, you know? Yeah. But I'll take my sass out of it. So a doula, from what I understand, and I'm not a doula and actually don't work with them very frequently, a doula is not technically a medical professional. So their job is to support the woman in labor, support the family. Almost serves as like a birth partner. Like, imagine if your husband or your partner knew tons of stuff about birth and the process and how to manage pain and how to reposition and how to care for a baby and how to initiate breastfeeding, and knew all of those things and was like the perfect birth partner. That's what a doula is.
Yeah, absolutely. I feel like they are also very much an advocate for the person in labor, because when you're in labor, when you're in active labor, especially if you don't have an epidural, you don't know what's up or down, you know? And if somebody asks you, like, what do you want to do? You know, we need to use forceps. What do you want us to do? I don't know. But a doula is there. You meet with them, you discuss it. And they say, well, remember, we discussed that you don't want to do that. And then the woman can say, yeah. Okay. So you're right. It is just a very highly educated partner in birth. And I mean, I think it's a beautiful tool. If I could have all of it, like when I had my daughter, I was like, I only want, my mom and the dad in the room. Like, how awkward for all these people to be there. But once I was in active labor, I didn't care who was there. Yeah. And it ended up being my partner, my mom, his mom, my godmother, and my aunt. So I go from like, I don't want a lot of people, to like a whole family gathering, right? Mm-hmm. And I was so grateful that I had them there. So I think like any support you can get in the birthing process that you're comfortable with, like I totally would hire a doula if I could.
Yeah. What's funny is I used to think I didn't want a doula because I was like, well, like, I feel like I know what's what. I know how to advocate for myself. Like, I feel like people will like listen to me or whatever. I've changed my mind. I think that I do plan on hiring a doula when I have actually never had children. But I think that when I do, I probably will have one. Just because they don't hurt. And my boyfriend is, if I were to marry my boyfriend or whoever it is that I'm with or have children with, they're great. They don't know jack, right? about kids, about birth, any of it. Mm-hmm. Also, the process of being in labor and having a newborn can be really exhausting for your partner as well. Yes. And sometimes just having that extra person there to support you, to take a nap or support that person and whatever they need, even if they're not providing amazing, medical decision-making expertise to you, just having a person who is there, whose only job is to support you.
Totally. Yeah. My partner actually said he was so grateful. At first, he was like, I don't want all these people there. He didn't even, when we were talking about it in my pregnancy, he's like, you want your mom there when you give birth? I was like, yeah, she's my mom. And then after the fact, he was like, I'm so grateful that all those people were there, because not only were these women who were able to, talk me through breathing, help holding my legs and just be there, he got to actually be the one to get my daughter when she came out. So I push her out, her shoulders come, and the doctors had him suited up. They let him be the one to hold her and put her on my chest. That wouldn't have happened if it was just him and I in there, probably, you know, he wouldn't have been as involved in that moment. So I think that's important too. You want the father to enjoy the birth of his child and not have to be basically working, because it's work, you know, like when the people, your support team are in there, it's work. I mean, they're exhausted too, like you said. So
yeah, for sure. Yeah. So doulas, there for support, not technically medical professionals. So they can't, like under the law, I think they can't like recommend certain, like say you should do this because it's medically good for you and your child. They can of course say like explain things to you and say, you know, kind of help you in making your own decision. But yeah, no, doulas are amazing. They have like a very important skill set for sure. And I think like often we think of doulas as being like primarily in the home and not so much like in the hospital. I think that they are so valuable in the hospital just because, you know, it's an environment that is foreign, you know, so to have someone who kind of knows like the ins and outs, what it's okay to ask for, kind of what to yeah, can be wonderful. Having a doula and a midwife and a supportive partner.
Yeah. Like the dream birth, right? Yeah, I have a friend whose husband was away when she birthed their second child. And so she hired a doula because she didn't want to be by herself. And, you know, that's another thing. Like sometimes people have husbands who travel for work. They have husbands who are in the military. You know, there's reasons that they might not be able to be there. Or single moms, you know, sometimes people are doing it all by themselves. I could not imagine giving birth by myself with just medical staff, you know. So there's definitely different reasons why you might look into that.
Yeah, for sure. Recommend it.
Yeah. Any other big myths that you hear that you're just like, I have to clear this up?
You know, just a big one. I heard somebody on a podcast. I think that this is probably clear at this point in our conversation for anyone that's been listening. But I was listening to a podcast and I heard somebody say, I don't want to have a midwife. I don't want to give birth in the woods. I know. So, I mean, just the idea that like, you know, midwives are like untrained or unsafe. And I also want to say that, you know, I feel like nurse midwives, at least for people who work in obstetrics, are generally accepted as people like safe, legitimate providers. But sometimes midwives who are not nurse midwives and are the midwives that do home births and birth center births more often, you know, there is a stigma about them. It's like, oh, you had a home birth with some like a water birth with some crazy midwife in your house. And she probably like just gave you herbs to eat or whatever. And I had an interesting experience. My sister actually, she had her first birth. She started in a birth center with a nurse midwife that ended up transferring to the hospital. It was a non-emergent transfer. She stayed under the care of her midwife. Her midwife attended her whole birth. So it was like a kind of a perfect progression of care. But then her second two, she had, I think in California, there's CPM, certified professional midwives. So two home births with this midwife. And I went to one of her appointments with her. And this was like after I was a brand new nurse and I was learning all about the ins and outs of like obstetrical emergencies. And I was kind of sassy and I was like, so what do you do if there's a hemorrhage? And I was kind of her expecting her to be like, oh, there's nothing we can do or whatever. But she was like, oh, we are able to carry oxytocin, which is Pitocin, Methergin, which is a uterotonic, a drug that we give in the hospitals to moms who are hemorrhaging to help their uterus firm up and stop bleeding. We can give fluids and we can give oxygen. Which like those four things are basically like the four frontline things we do in a hospital.
Right.
Oh, so it sounds like you basically do the same stuff we do, which of course, like it's not the same thing, right? Because in a hospital, you have a whole team of people who are, you know, used to doing those interventions. You have anesthesiologists normally close by, you have physicians, you have surgeons. So it's not the same. There is a level of risk there, but the idea that they're totally unprepared is or don't have safety practices is not true. I will say that because the state laws differ so much, like there are some states where somebody can practice midwifery under the law with relatively little training. And one thing that I think is really unfair is that we don't have a very good way of helping women or families know who's who.
Right.
I think that is a big thing. And even not so much to say that those people shouldn't practice, but to help people choose somebody that they're comfortable with. And so I think if you are going to have a midwife, and especially if it's not a nurse midwife and you're planning on doing it with a what we call a direct entry midwife, which is anyone that's not a nurse midwife, and you're planning on doing it in the home or in a birth center, just make sure you ask, like, what kinds of things could come up in my pregnancy that would cause you to prompt me to maybe go to a hospital instead? What kinds of things in labor would you transfer for? What kinds of emergencies are you looking out for, and what do you do? Just to get a sense of if you feel comfortable with that they're prepared. And most of them are, truly. Them are prepared. But like I said, because it's not well regulated and there's such differences in how it's regulated, I don't think we do a good job of like making it really clear to people what they can expect as far as safety.
You should start some kind of like registry that people can look up and kind of have like a definition of each one and then be able to look at someone's credentials. Like that would be cool.
Yeah, I mean, I feel like that probably exists. I know that like I imagine that states have registries for like certified professional midwives that have like a base level of education. But yeah, we should do that. I should do it, or the government should just do it, right?
Right. Yeah, totally.
I know that's asking that's a big ask to like try to keep people safe, but right. Yeah. Also, I know that part of the pushback is kind of, that like a lot of people distrust obstetrics, right? Like distrust hospital births. And that distrust is well earned because the field of obstetrics has done wrong by women for a long time and continues to do wrong by women today in some ways, not always, like absolutely not always, but we have a long way to go as far as really improving our practices. And I think that is true for physicians, it's true for nurse midwives, it's true for regular midwives, right? It's true for everybody. And so I think that there's a lot of mistrust there, like that I said, that is well earned. But it sometimes prompts people to swing kind of too far the other direction, right? Where they're afraid of any intervention instead of looking at, well, we talk about like interventions in labor and it's kind of like a dirty word, like the intervention cascade, right? I try to think of things not as interventions, but as support. One thing that is kind of unique to midwives is that they have a very strong, and this isn't a myth, it may be something that people just kind of midwifery 101, is the emphasis is on what we call physiologic birth, which basically is the body of the woman and the body of the baby doing what they're kind of meant to do, right? So things are just happening naturally, like without too much interventions. And it kind of is based off of the belief that like women are inherently capable of birthing and that babies are inherently capable of being born. And that instead of taking an approach to step in and to fix or take over, we want to do things that are going to support them in the work that they're doing. Breaking somebody's water, so artificial rupture of membranes in order to try to help labor go faster. Sometimes it's absolutely the right thing to do. Sometimes it is really helpful. And it is the right thing to do when it is going to support the labor course of that woman and support her body in the work of laboring. And so it's not like, oh, we need to do this because something is wrong and we need to fix this situation. It's maybe there are some things we can do to make this easier for you, to make this more comfortable for you, to help your body have the tools and resources it needs to do the thing that
Right.
it is going to do. That's another thing, is that midwives don't deliver babies, women deliver babies.
Oh, I like that.
It's like a weird, like, just verbiage thing that we tend to
Yeah.
not say, like, oh, I delivered this baby. It's like, oh, they'll say either like I attended the birth or I caught the baby. But you know, the belief that the woman births the child, right? And even in the case of a C-section or an operative birth, like forceps or vacuum, where there is a lot of like force by an outside person, I think it's so important to acknowledge that that woman's body built that whole baby,
Right.
often initiated and worked through that labor course, and then heals itself, right? Like, you heal them, you sew them up, and then their body heals itself, heals the incision, like it just fixes itself. So
yeah, that actually leads me into a question. So do you have any like statistics, or even just from your experience, do you feel like working with a midwife versus working with an OB limits those interventions or complications or anything of that nature?
yeah, so I don't have the statistics off the top of my head, but I do know that assuming a low risk birth, the risk or the incidence of C-section is much lower. I think in the practice that works at my hospital, I think it's 6% for low risk first time moms. And I think that like the national average is maybe like 30, like a big difference.
Yeah.
And then I think that their epidural rate is something like 60%, and like the national average is like 85. Which, you know, some there it's kind of like, we know which comes first, the chicken or the egg, because somebody who doesn't want to have an epidural is like more likely to seek
That's true.
a midwife often. Water birth is something that's interesting because it kind of happens. Some places it can happen, some places it can't. Like there are some hospitals that don't allow labor or birth in the tub at all. There are some where they will allow you to, by the way, I hate this language that we have about allowing, right, women to birth their own child.
Yeah.
But here we go. That will allow you to labor, but will not allow you to actually birth in the tub. Where I work at the University of Utah, the midwives actually just finished up a study on water birth in the hospital setting, which there's good research that says that water birth doesn't really carry any additional risks. But most of that research was done outside the hospital. And so they did this one in the hospital just to kind of add to the literature. And so now the study is over. And so now it's like theoretically anybody can labor and birth in the tub, assuming if you don't, there are certain risk factors that, you know, they won't allow you to. But the other thing is like the patients of the physicians are technically able to, but you have to have a provider or a physician who is willing to attend that water birth. Okay. And I think we have one that will, and there's like tons of doctors. It's a big hospital, and we specialize in high risk obstetrics, so we have tons of OBs. And I think there's one that might attend a water birth. Wow. All midwives do, because it's, you know, that's what you do with midwife. In the tub, in the shower, in the bed, on your knees, upside down, whatever.
Whatever works, right?
Now, midwife can catch it. So
yeah,
there's a tidbit about water birth.
Very cool. Yeah, the hospital I delivered my daughter at, it was optional if you wanted to birth in the tub, but labor in the tub, but you could not birth in the tub. I ended up getting an epidural, so I birthed, on my back. And then with my twins, it's like a whole other experience because you have to be in the operating room. They told me that I didn't have to have an epidural, but if I didn't, then they would have to knock me completely out if I ended up in a C-section. And then you have your OB team, the NICU team, the specialist team. It was wild birthing twins, but I was able to birth them vaginally, which I was very grateful for because I had an OB who was kind of pushing for a C-section, and I was like, I got this. Like I told her that I was like, I can do this. Like I have a feeling that it's going to be fine. and I birthed both of them vaginally, you know, and he kept trying to kind of intimidate me, like, well, you could end up birthing one vaginally, then you have a C-section, and now you're healing from both areas. And I was just like, okay, that's a risk I'm willing to take.
And I've seen that happen where people have birthed one vaginally, and then the cervix did not want to stay open, and they worked at it for a few hours, and she ended up having her second twin, different method, different day. So they had different birth days.
Wow, that's wild.
But you're right. Like, yeah, sure. Like that could happen. Is that what you want? Probably not. But like, you need to be so afraid of that you're just going to throw in the towel, right? And obviously the answer is no. It is kind of, I was just thinking about that. I thought, I'm pretty sure that the midwives attend the births of multiples at my hospital, but yeah, they do always have them labor in the OR just in case.
Yeah.
Yeah, that's kind of lame. I mean, I appreciate, it's all about risk reduction, right? It's
right.
But
it's odd. It is very odd to give birth in the OR.
A hospital room, like a regular labor room, is like weird and sterile enough, and then you go into the OR and it's totally, it's different. Yeah, we're working on it. They need to get more comfortable ORs. That's what we need to do.
Yeah, like how special is this for us multiple moms?
Yeah.
Well, very cool. So my final question, I learned so much. Thank you. This was wonderful. I actually would love to maybe narrow in on a topic and have you back on so that we could, because this was kind of like an overview rather than zero in on like specific topics. But my last question for you is, if somebody is considering midwife, what is your advice to them as far as like finding the right one for them?
That is a great question. So first I would say, if anybody is unsure of if they want to go to be seen by a physician or be seen by a midwife, I think some people aren't sure like if they're a good candidate for midwifery because of like health issues or whatever. I would see both, and any physician or any midwife should be able to tell you whether or not you're a good candidate. My other advice would be, and this is for midwives and also doctors, but like if you go to a midwife because you want a midwife and like you're not really vibing, go get a different one.
Yes.
Because, we like to feel good about ourselves in the field of midwifery, but we are not perfect. We are not a great fit with every single patient. And so much of your birthing experience is the confidence and the trust that you feel in your provider. So feel free to shop around as much as you want. Until you feel really good, and not just okay, until you feel really good. You like the person listens to you, respects you, that you trust them, that you're on the same page. I interviewed a pediatrician, and we touched on that a little bit as far as pediatricians go, because a lot of it is, it's not insulting. It's not like I think you're a bad doctor, but it's like, who do I vibe with? Who do I mesh with? Who has the same type of thought process I do? So I used to work in pediatrics. So I took my kids to the place I used to work, and I chose the provider who I got along with on a personal level. Well, she wasn't there, and I ended up seeing a different provider who, it's so funny, we talked about this little disagreement we had, and I saw her once and I was like, oh my gosh, like, she is the doctor for me. And she recently left that practice to go to a different one, and I followed her because the way that she practices, she's just, the other one is a little bit more casual, whereas she is very like every little thing. And I'm so neurotic that I need a doctor who's going to tell me if there's a 0.1% chance that this could happen, and so she does that for me. And so it's not insulting to the provider. I felt bad because I knew her on a personal level, but everybody there was like, it's not insulting, like that is who gives you the type of care for your children that you want. And that's okay. Everybody has a different style. And the OB that I actually went to for my twins, the first one, when I found out I was having twins, he told us in such a strange way that I go, so if that second little knob isn't a baby, what is it? I thought I had a growth or something in my uterus. He's like, oh no, it's a baby, but I don't think it's going to stick around.
So I didn't stick around with him. I found a different doctor because that was like a horrible, I'm like, I think I'm pregnant with twins, but I think one's going to absorb into my body and die. Like, I don't know what's happening. So I found a different OB.
Yeah, that's exactly what you should have done. Things people say.
Yeah.
Well, thank you so much for having me. I want to, is it okay if I plug myself real quick?
Always.
I actually am I'm just getting started with a birth plan consulting business. I feel I should maybe said this at the beginning, but I feel like birth plan is kind of an oxymoron, right? Because who can plan this? But I've started a business where I help women kind of prime the pump for the decision making that happens in pregnancy and in labor, and just kind of empower them and prepare them to make decisions and just kind of get we can't guarantee the birth that we want, right? We can't plan it out, but we can set ourselves up so that no matter how things go, it's a process that we feel good about and that isn't full of regret. So if anybody wants some of that, let me know.
Yeah, deliver with confidence.
I'm just getting started, and so like my presence on social media is like non-existent.
Okay.
And but the nuts and bolts are in place. So I'm doing it.
Perfect. I love that. I think it's definitely something that's needed. And I'll add any links down below so that people can find you, because I think that's beautiful. So are you doing it virtually too with people who aren't in your same state?
Yeah, I'm only doing it on Zoom.
Oh, perfect. Okay. Yeah, I interviewed my cousin. She was pregnant with her first child. She just had him a couple weeks ago. And we talked about a birth plan. And she's like, I never even thought about that. Like, I didn't think about it. And the advice I gave her is, you do have to know in your mind that it might not go as planned, but it's important to have a birth plan in place, because if something changes, if you do get asked, like I mentioned before, are you okay with us using forceps? Are you okay with us? You need to already be educated on that and know your stance. You know what I mean? Because what are you going to do? Google it while you're in active labor? Like, oh, let me find out exactly what the risks and the benefits are of this. Right. So I just think that's really important for you to have the extensive education and knowledge you do to provide that to moms. I think that's really cool.
Yeah. And I think part of it is even like there are absolutely nobody wants forceps. There are absolutely situations where forceps are indicated. But it's like helping women have the language to, like, if that's presented to them, for them to say, I need you to explain to me why this is happening, and like a lot of the birth plans isn't like, I need this to happen or this to happen, but it's, if you feel like this is needed or indicated, talk to me first, get my consent first before.
Yes.
But awesome. Thank you so much for having me. I'm so glad we met on Clubhouse.
Yes, I am too. Thank you. This was awesome. And good luck to you. I'm sure things will go great with your new coaching business. Or not coaching. Everyone's doing coaching.
I know.
Your birth planning business. Very cool. I've never heard of that. So it's unique to you.
Yeah.
Yeah. All right. Well, enjoy the rest of your day. Thank you so much for your time.
Yeah. Thanks for having me. I'll talk to you later.
Bye.
Bye.
I got to get back to work, guys. I'm literally sitting on a desk in a vacant office because I did not bring my tripod because I'm a big old dork and we just moved floors. So I don't even know if I'm allowed to be in this room, but that's podcasting on the go. So that was a beautiful conversation. If you have any questions for her, I'm sure if you direct them to me, I can get them over to her and she'd be happy to answer them. I have a very, very basic knowledge of, I can't even say the word, midwifery. And doulas and all that stuff. So I'm happy to answer questions as well. I hope that if you are considering a midwife, or if you didn't know what midwives were, or even if you didn't know they existed, now that you do, you have some education on it. So happy birthing. This is exciting. I think her birth plan idea is super cool. So if you are pregnant and you're considering a birth plan, have a chat with her and see if maybe she can help you out a little bit. And if you like this type of content and you would like to subscribe, hit the notification bell so that you can get notifications whenever I upload a new video, which is going to be Tuesdays and Thursdays. If you're listening to this on audio, then subscribe, and you will also get notification. I would love to see you back because together is a beautiful place to be. Bye.